said that even now that the hospital is being overrun with COVID patients. They come in, they're horribly ill, they're gasping for breath, and yet they don't believe they have COVID?
Yeah, I think the hardest thing to watch is that people are still looking for something else and they want a magic answer and they don't want to believe that COVID is real. And the reason I tweeted what I did is it wasn't one particular patient, it's just a culmination of so many people. And their last dying words are, this can't be happening, it's not real. And when they should be spending time FaceTiming their families, they're filled with anger and hatred, and it just made me really sad the other night. And I just can't believe that those are going to be their last thoughts and words.
Anger and hatred towards you?
I think it's just a belief that it's not real, and nursing happens to be on the receiving end of that. And that's okay. We can take that. That's what you're there for. It's just in the bigger picture when you try to reason with people of, can I call your family, your kids, your wife, your friend, your brother? And they say no, because I'm going to be fine. And you're watching their oxygen levels, maxed out on what we call vapotherm at 100%, and their oxygen level might be 75. That's not really that compatible with life. And we know where that's going to head. And it just makes you sad and mad and frustrated. And then you know that you're just going to come back and do it all over again. And that's kind of where that stemmed from.
How could it not make your own head explode? They're gasping for breath. Their oxygen levels are dropping. What do they think is wrong with them?
I think people look for anything. People want it to be influenza. They want it to be pneumonia. They want it to be, we've even had people say, well, I think maybe it might be lung cancer. Something so far-fetched. And the reality is, since day one, when COVID started in this area in March, you've kind of been able to say, if it walks like a duck and talks like a duck, it's a duck. Like, I hate to tell you that you have COVID, but that's what you have. Even after positive results come back, some people just don't believe it. Now, that's not everybody. We have a lot of patients who are very, very grateful for their care and very thankful for what you do. But unfortunately, that's not what I'm remembering right now. And as my nursing career, that's not what I want to be remembering for. I want to remember the saves and the happy situations. And what I was remembering chilling on the couch the other night with my dog was not that.
Of course not. Of course not. And it's just so mind-blowing to think that they would rather have lung cancer. They'd rather a diagnosis of lung cancer than of coronavirus. And so, you've said that it just, if I quote you from morning television, it's an effing horror movie that you live every day. And so what toll is this taking on you?
Yeah, hindsight, I didn't realize that this was going to go viral. I probably could have left the F-bomb out of there, but the reality is that's how you feel. And so it is like it's just a movie where the credits never roll. You just do it all over again. And it's hard and sad because every hospital, every nurse, every doctor in this state is seeing the same things. These people get sick in the same way. You treat them in the same way. They die in the same way, and then you do it over again. And we're so thankful for the lessons we've learned along the way, and we're doing a good job of taking care of the people that come in. And we're managing our patient loads here right now. Sometimes it's day to day, sometimes it's hour to hour. But the reality is that right now it's not getting better. You said just as you started the show, 50 to 60% positivity rate. Our entire state has 880,000 people. It doesn't take much to do the math on that for how many of us are sick.
Oh my gosh. When you hear your governor, Kristi Noem, say, my people are happy. They're happy because they're free. What's your response?
I think it's frustrating as a healthcare provider because the last thing that we ask anyone when they seek care is how they voted or if they're a Democrat or Republican. The last thing we ever think about is that. What we think about is, how can I help you? And so anybody that uses any chance to make this political makes any healthcare provider want to scream, because at the end of the day, we just want to help. And if we don't get some help from the public as far as mask wearing and social distancing, There's a thing on the internet right now that says, I'm not your first line of defense, I'm your last. And that actually is true in South Dakota, that by the time you get to me and the team that we work with, it might be too late for some. And that is heartbreaking, because the reality is we're a small state. The town I live in has 650 people, and we have 680 deaths right now. I mean, that's my entire town wiped off the map. We know these people, we go to school with them, church, grocery store. It's every small town story you've ever heard.
But just so I understand, Nurse Doering, you have more deaths than you have people in your town.
Yeah, in the state of South Dakota, I haven't looked in the last few hours. I think we had 683. Don't quote me on that. But the town I live in has 650 people. So when you put in perspective, and people listen to me talk about this for the last 9 months, that's every single person in our town gone. That's pretty mind-blowing. If we had a tornado that came through and killed 20 people, we would stop and look, and the national news would be there. And so the fact that we have this many deaths in a town or in a state this size is mind-blowing to me, and it's not currently getting...
That was absolutely tragic and horrific. I brought you a full news segment there. I don't often do that, but you needed to see that in full. That was a South Dakota ER nurse basically saying that in that state, which is seeing a real spike in the amount of COVID cases over the past few weeks as it spreads across the US because there hasn't been enough social distancing and masking and things like that, people are getting it and they're passing away from it, or they're coming very close to passing away from it. And all the while, these people believe in their hearts, in their souls, in their minds, that this was a hoax, that this wasn't real. And that because of that, they're inexplicably angry and they feel betrayed. That in these final moments where they should be preparing to say goodbye to their loved ones or preparing their final affairs before they pass on from this planet, they're just angry and betrayed and irrational. Because this can't be real. Because the president told me it wasn't real. Because Fox News, some people on Fox News told me it wasn't real. Because people at OAN or Newsmax told me it wasn't real, because some random right-of-center Twitter account told me it wasn't real. And I believe those folks. I believe the televangelist that told me I could just say a quick prayer and it would go away. I believe those folks. And now, I'm losing my life to this thing that I thought was fake. This is a real indictment of American society. It really is. This is a healthcare worker who is putting herself on the line, her butt on the line every day, every hour, every minute. And that's also likely putting her most dear loved ones, her family and friends and children. I don't know if she has children, but her closest people in her life at risk, because she has to go into these hot spots every day. And all she's trying to do is help these people. That's all she's trying to do, is help these people. And people, whether it's because of selfishness or because of indoctrination or likely a bit of both, are continuing to act like kindling to this illness that continues to spread across the United States even more than other developing nations. I'm not trying to paint a rosy picture of Canada or of many European countries where there's been resurgences of this illness. But the United States is a case above. And it's because of that anti-science, narrative that's been brewing from the president on down. And it's making the jobs of doctors and nurses and other healthcare workers and other public health officials like Dr. Fauci and everyone that works under him that much harder. So please, social distance when you can. Avoid going out when you can. Wear a mask when you can, which is for many people almost always when you're out of the house. And do what you can to show this information to people. People need to realize that their actions matter. And I know we've been getting positive, news about vaccines from Moderna and from Pfizer. And that's great. That's really great. But that's still weeks, if not months away. And it won't go to everyone right away. It'll go to the most vulnerable and most essential first. And that's good. And that's correct. But that means that we can't all just pretend like January or even February, we're all going to be able to go back to hockey games and football stadiums and basketball, arenas. We won't be able to yet. And so we're still, until everyone can get that vaccine and we know it's safe, everyone's going to have to wear their mask and practice social distancing. If we really believe healthcare workers are champions fighting in this glorious battle, and they are, then we need to do our part to give them all the tools they can to succeed and not sabotage their work. If you have somebody in your family or your friend group that denies this, show them this and show them how they are playing a role in making the jobs of healthcare workers that much harder.